100.1 WROI. Here we are on a Wednesday. Time now for our Woodlawn Health Report. Brought to you by Woodlawn Health. This is Brad and Carissa join us. Good morning.
Good morning, Randy. How are you today?
Doing well. How are you guys?
Yeah, I think we're doing all right, aren't we?
We're good, yeah.
It's a little cooler today than yesterday, thank goodness.
Just a fuzz right now. Yeah, it's 73 right now, so we'll see. They'll say up in the 90s today. So
Okay.
yeah, be prepared.
That's right.
Stay
that's
hydrated.
Right. Absolutely. That's important.
How are things in Woodlawn Health?
You know what? We're trucking right along. Enjoying the summer, and I think a lot of us are enjoying the kids getting back in school and kind of getting back to that normalcy.
Normalcy. What is that?
I'm not sure yet.
Going crazy, right? Running
I asked
around.
my wife. She hasn't told me. Until she tells me, I don't believe it.
That's right.
That's right.
Or you see it on Facebook.
That's exactly.
Yeah.
There you go. There you go. No, everything's going well. Ended up finishing up the month of June. It was extremely busy month. About 3% above where we were last June, and about 3% above where we were budgeted for this year. So kind of making consistent headway, which is always good. Again, we talk about this from time to time. We're in an odd business. When we're doing well, that means people are sick, but we have to look at it as though we're here. Mm-hmm. So when people are feeling bad, we're here to make sure we take care of them. And so when we see those increases in numbers, it's really a blessing that we have a local hospital here that can take care of us when those things come up. So we had a positive operating income for that month of about $36,000, which was there in June. And a lot of that, our inpatient unit was busy, our laboratory was busier, imaging departments, and our physician office visits. So lots of areas that increased overall through that time frame.
Well, it's nice too because you've added several physicians to it to be able to take care of the need.
It's wonderful that you should say that. It was almost like that was a segue. Yeah, we do. We have, Dr. Walton, our new OBGYN, who's there at Woodlawn Medical Professionals. We've got our new podiatrist, Dr. Rindlisbacher, who's there at Schaefer Medical. Carrie Pulley, new family practice nurse practitioner out at Akron. And Kelly Orrs, new physician assistant there at Schaefer. So, yeah, we kept Krista very busy there for that month because we added 4 new providers in a very short period of time.
Yes.
So, absolutely, it is good to have that. And, we're still looking for more. Still actively recruiting a couple primary care physicians. State does these kind of little numbers from time to time where they look into this population size, where we're at based on the number of physicians for our population, and we're still a couple short. Okay. So we're still looking for those. So we'll keep you posted on that. Overall, then for the month, we had a net income of about $281,000. So still moving forward in a positive direction, and obviously leaps and bounds where we were a year to 2 years ago, ending the COVID era and moving forward. So very, very happy about that. Do have an announcement. Our director of nursing and vice president of patient services, Paula McKinney, is retiring.
Oh. Okay.
She's been with us for many years, and she is irreplaceable. There is no question. But we still have to find someone. And we're very fortunate we found Kathy Lowe. Kathy Lowe is going to be our new chief nursing officer. She'll be starting at the end of September. Kathy will replace that role for Paula is leaving in December. Kathy was born at Woodlawn Hospital.
Cool.
So I say she's coming home.
There you go.
So we'll be excited to have her brought on board. Kathy has her doctoral degree in nursing as well as her MBA. And everyone, warm welcomes to her when she comes in at the end of September. And when you see Paula out there, just thank her for all those years of being our chief nursing officer and all the things that she's done for our hospital. She has really made significant differences in our hospital's safety, clinical quality, and overall, we would kind of call our clinical decision making and practicing based on standard practice patterns and clinical efficacy. So we'll thank her when you see her. Education wise, Dining with Diabetes, our Purdue Extension here in town does a great job putting on courses, and they've partnered with us starting in September, September 11th to be exact, at Woodlawn Hospital. The Purdue Extension will be putting on a Dining with Diabetes course. Now, it's several classes over about a month. You can register for that class at 223-3397. You need to do that by September 3rd, though, because space is limited.
That's coming up next week.
Coming up next week, yeah. The second is Labor Day,
Yeah.
and so by next Tuesday, you need to let them know if you're interested. That'll be done there at Woodlawn Hospital in classroom A and B on the second floor in the education center there. So reach out.
Some great. I was talking to Jessica earlier in the month about it, and some great recipes she'll be going over and doing stuff. So a great class there.
Yeah, there's 4 different components. The first week you're going to talk about what is diabetes, and then looking at some different snacks and appetizers that you can make that fit into those dietary needs. Week 2 is going to be carbs and sweeteners, and they're going to teach you about some desserts that you can make that stay within that diabetic diet. And week 3, fats and sodium, and then how to make main dishes and reduce those things. And then at the end, it's going to be kind of putting it all together and making some side dishes and stuff. So they do a great program. We're glad to have them back at the hospital.
This year it's free, and past years we've had to charge. So this
Correct.
year it's free through some granting opportunities that Purdue Extension was able to get. So this is the best time to take advantage of it. We don't know if the next session will be free. So if you've been wanting to do it and cost has been some kind of an object of deterrence, we really encourage you to do this. It's a great education. It's one of the one of the top diagnoses in the county.
Yeah, Fulton County diabetes and COPD are 2 of the top we call morbidities or challenges that we face, and so this is a great course. Again, you can reach out to Jessica at 223-3397. Please do so before September 3rd.
Yeah, I want to thank Fulton County Health Department. They're part of that grant as well. So,
Yes,
some
absolutely.
Indiana health money that they've got. So.
Correct. It's a wonderful thing. Swing bed. So we want to bring that up because swing bed is the term that we as clinicians use, and we really need to explain that to the community. Swing bed really means
Not a swing?
It is not a swing.
Oh.
The bed doesn't swing, right,
The
Brad?
bed does not move.
No.
Swing bed is a term that is a clinical term. It is a term based on the federal government's designation as how they pay for certain things. But what it really means is rehab to home. So if you hear someone say Woodlawn swing bed program, it is a rehab to home program. And really what that means is for those individuals who have been in the hospital, who have gotten the acute care needs taken care of, they're stable, they've had whatever procedure or surgeries they need to have, and they're just not quite ready to be back to their normal functioning level. That's where the rehab to home program fits in. It is intensive therapy every 5 days a week and on Saturday, physical, occupational, or speech depending upon your needs, and the goal is to get you home independently to the setting you were in before you went into the hospital. And so we just wanted to bring that up and make sure people understood that difference. I'm a clinical person. I'm a physical therapist by background and training for over 25 years. So for me, I say the word swing bed, it's just normal. Krista, on the other hand, is not a clinical background. So when I say swing bed, she goes, what?
Yeah.
So we want to make sure that we let the community know what that means. And it really is, it is a way to get you stronger. It's a tune-up, so to speak, to get you ready to go back home independently as much as possible. So we just want to bring that up.
And I also think one of the best advantages to swing bed is that you're able to transfer to our rehab to home program from another facility. So say maybe you had to go to another hospital for a surgery that Woodlawn doesn't provide. You can request from the social worker or the discharge planner for them to contact us and to get the information, and you can come to us as part of that program. Sometimes I think that's a misconception that you have to be at Woodlawn,
Absolutely.
but you're able to transfer. And in fact, at the last several people who we've been able to service with this program have transferred in from other hospitals, and we're working to continue to build those relationships with other hospitals, because we know that we can do 80% of the service, but there's a 20% chance you could be somewhere else and needing to get closer to home, and we're happy to help you with that.
Yeah, any way that we can get a community member back closer to their community improves their overall outcome. We want to make sure that family members and friends have the opportunity to visit. Sometimes it's a little bit of a burden for someone to drive all the way to Fort Wayne or all the way to Indianapolis a couple times a week to visit their family. So we have that opportunity here. And like Krista said, you just have to let your care providers know wherever you are that, hey, what about that rehab to home program at Woodlawn Hospital? Is that something we could think about? And they'll reach out to us and we'll talk about it and see if that's something we can do. But we'd love to have you taken care of right here in home.
Sounds like a great opportunity.
Surveys. So I bring surveys up because it's important to Woodlawn Hospital that we're always determining, how are we doing? Are we doing well? And one of the things that we utilize is a Press Ganey survey. And a Press Ganey survey is a organization that is outside of Woodlawn that contacts patients after they've been discharged from the hospital or after they've received services at the hospital and does surveys with them. I bring it up because in the past they've done that via telephone calls. But that's going to change. So they're going to start receiving surveys sent to their home.
Okay.
Paper surveys. I wanted to bring that up because that is us, that is Woodlawn. We are reaching out and wanting to know how we're doing. But that is done by an outside entity.
They just do all the work for you.
Well,
Taking some of the
it takes some of the burden off, but
burden,
the
yeah.
big thing is that it makes it objective. It's not us calling and asking the questions.
Right.
It's a nationally recognized company that does the same thing for hospitals in Indianapolis, Fort Wayne,
Right.
South Bend, and our next door neighbors. So the data is then perfectly comparable to all of those other institutions.
Well,
So-
and sometimes too, say you did have a bad experience, you may not want to tell your doctor or somebody that you know from Woodlawn calling. You may not give an honest answer.
Correct. These are
With
anonymous.
a third party.
Yeah, these are anonymous surveys.
You can.
You should feel comfortable
Yeah.
doing that. We just wanted to let everybody know, I don't know about you guys, but I get phone calls every evening of the week
Yeah.
from that pop up as spam.
Yeah.
And
Spam or numbers I don't know.
correct. And so this is just letting you guys know we're transitioning away from that because that was a challenge to doing them on paper for the community. So if you see those,
will it have like Woodlawn?
yes, it'll
insignias
talk
and stuff
about
on
your
front?
yes.
Okay. Perfect.
You were recently discharged from Woodlawn Hospital,
Right.
and then it'll go through a series
Perfect.
of questions for you. So just letting you guys
So it'll
know.
be obvious that it is what
Yes.
it is. What it is.
Yes, absolutely. And then, we just talked about how COVID's over, right? One of the things I want to bring up is just, there are still variants of COVID going around. And right now, the state of Indiana and Fulton County is experiencing an increase in COVID cases.
Yeah.
So far, they are not in the severity that we've seen in the past, causing, the hospitalizations and the taxing on the healthcare system. But we just want to let everybody know, be aware of that. If you're having symptoms, fever, cough, cold-like symptoms, those kinds of things, it could be one of the new variants of COVID. And just take your normal precautions. Wash your hands a lot. If you have a fever, don't go to work or school to pass that on. And just letting you know that it's still there.
Yeah.
Yeah.
It's not like you said, not as big a deal as it was, but it's still there, and to take care of your normal.
Yeah, we
health
should treat
needs.
it. Yeah, we should treat it like we do any other flu type situation,
Cold,
a respiratory
whatever.
problem. Is that if you're in an infectious state where you've got a cough and fever and those kinds of things, well, we've always known that you probably shouldn't be around a lot of other people, and so let's just kind of keep that thought process going. Standard infection control precautions.
There you go.
And then on a totally unrelated note, but it's getting that time of day. We've got a food truck coming to the hospital today.
Hey.
They're setting up now. This is called Fire Up the Grill.
It is.
They've
about
got
that time.
tenderloins, handmade tenderloins. They've got brisket sandwiches.
Mm.
They've got a lot of things. They'll be there in the front parking lot of the hospital today from 11 a.m. to 7 p.m.
We better hurry up.
Community is absolutely welcome. We'd love to have you all come out. And as we were driving by, they were finishing their setup, and boy, it looks like it's going to be pretty good
It's
stuff.
starting to smell good. Was it?
Absolutely.
Yes.
Absolutely.
I smell it all day.
And then, Krista, you've got some things you want to talk about as far as events in the community and such.
So we love being out in our community, and we're starting to wrap up summer, which means we're wrapping up. We call it the event season at the health system because we are always wanting to be out greeting and meeting our community. So thank you for everyone who stopped by and saw us at fairs and parades and community events. We really appreciate that. We love hearing and just meeting everyone. That's a huge joy for clinicians, I know, and it's a huge joy for me as well, and as a non-clinician. Some of the things that we have going on is Rochester Parade is this Saturday, so we will be participating. It's the first ever, so we're excited to be a part of that. Kiwanis Fall Festival kind of wraps out the parade season, and so we will be in that. And then we have the TGIF events in August, which are so much fun. And last but not least, it is the event that comes to Rochester downtown in October 12th is the chili cook-off. So we will be there. We have something super fun planned. I can't tell you what because I don't want to give it away to our competition. But
That's right.
you need to come out and taste our chili and at least visit our booth. It will be epic. And then last but not least, we want to always remind people it's our goal in Woodlawn to be as transparent as we can, but also to communicate. We have a lot going on, and it's hard to fit it all in a radio segment. So please, if you don't already, follow us on social media. We are on Facebook and Instagram. We also are on LinkedIn as well. So if, that's a great place to find out about job opportunities. We're posting those on a weekly basis and multiple times a week. So please come follow us on that. We also, our website, woodlawnhealth.org, that's something that we're updating sometimes weekly or monthly. Lots of different things are going on, from podcasts to articles. We want to make sure our community is informed and making those informed health decisions, and because we want to really earn the right to care for our whole community. That's more than a motto to us. That's next to our mission statement, pretty much.
Yeah, I think one of the most enjoyable parts of the event season is a chance to get to see a lot of the people that we've cared for over the years. You know, I've been with Woodlawn a little over 18 years, and so in the therapy department, I've worked with a lot of people in the community, and it's always a great thing to see someone that you've worked with and cared for out in the community doing well, moving well, and just to get a chance to say howdy. It's a lot of fun. You know, sometimes I'll even run into local radio people at, you know, at events, and they may or may not make fun of me. Take pictures and such. But you know, those are good things because that's who the community is.
Yeah.
The community is this group of people who work together each and every day to do, you know, not only their jobs but to help take care of each other. And so it's a good thing, and we really appreciate it.
Are you the chef for the chili cook-off team?
No, but I'm the taster.
You're the
I'm
taster.
the taster.
Everybody volunteers for that
That's
spot.
right. That's right. Absolutely. It's a good spot to get.
We have an internal competition, so Brad gets to determine the judge on that.
Oh my.
So we are absolutely very competitive. And so we've got a lot of teams from different departments who are, we'll be doing our own internal
to see who
gets the
reward to go
privilege
on.
of representing the
Yeah.
hospital on October 12th.
Sounds
So
like fun. If you
it
need
is
help
gonna
with
be a lot
that
of fun.
testing, let me know.
Absolutely.
Okay, we'll keep you in mind, Randy.
Sounds good. Hey, thanks a lot.
Hey, thank you guys for coming in. Have a great month, and we'll talk to you next month.
Sounds great.
Woodlawn Health Report here on Giant.